Good morning, friends. We are happy to be back in Trichur for the Drishti. As usual, me and Ashok has a session on medico-legal basics for ophthalmologists. Our aim is to improve the legal literacy of our doctors. Ashok is a qualified lawyer and I have a small diploma. And we have esteemed panelist Professor Charles Correa, who is our guide and mentor in many things, not only medico-legal aspects. Dr. Dr. Jayaprasad, he is a very senior person managing multiple hospitals. Then Dr. Jain Chiman, a local person who is in charge of IMAPP scheme. He was in charge of IMAPP scheme and a well-known person in legal matters among doctors. So the objective of the session is to remove the fear factor. The moment you get a notice from an advocate or patient, first thing is the doctor starts trembling, shivering, as if something has gone totally wrong. So it is just a notice. You have to reply that, that's all. So you are not punished, you are not, remove the fear factor, that is the main aim of this session, and improve legal literacy. We are calling it legal literacy because many of our doctors are not knowing what is our rights and how we can defend ourselves and learn to defend and fight back. That is very important. Case കൊടുത്ത പേഷ്യന്റിനെ എങ്ങനെ പണി കൊടുക്കാന്നുള്ളതാണ് നമ്മൾ അറിയേണ്ടത്. I think this is not recorded of this. So objective of the session is this one. Patient can sue us in civil jurisdiction. Civil courts and consumer courts are the commonest. And then criminal jurisdiction is unlikely, but there are a lot of complaints in criminal courts also against doctors. So that is, now especially in some specialty like gynecology and obstetrics, then some people go to Human Rights Commission and even health department, ministers like that, and medical council is also there. A patient can complain in a medical council against the unethical practice of doctors. So in fact, way back in 1995, Indian Medical Council versus VP Shanda brought us against under the Consumer Protection Act umbrella. So till that time, doctors were God and patients were just patients. Now they are consumers and we are liable for all the litigations. And a lot of things has happened, as some people don't know that even camps that are included in the Consumer Protection Act. So nothing is free. Any patient can sue us, even if it is a camp patient. So I will pass on the mic to Dr. Ashok Natarajan. We will start with a case scenario.
Thank you, Dr. Mahesh. I would like to introduce the topic with few things. Now, even though patients have a lot of avenues to complain against doctors, they go with the Consumer Protection Act because it's the simplest way that they can do it. Because, Consumer Protection Act, they can give the complaint in a plain sheet of paper in writing. Nowadays can be filed even online. And it doesn't matter where the cases happen. Suppose you have treated a patient from Bihar, a patient can file a consumer protection case against you in Bihar. You have to run to Bihar and defend the case. So, and the amount of money they have to deposit in the court to get a huge compensation is very, very less. For more than 2 crores, I think only 5,000 or 6,000 rupees the patient has to spend. So that is why, in spite of all the other avenues they have, they go for the consumer protection forum. Even the civil courts, even if you are filing a compensation, about 10% of what you have claimed, you have to deposit in the court. Only then the case can move forward. So that is the main crux of why they go for consumer protection courts. Now, this is one patient. Now we are talking about a cluster endophthalmitis. So this was a real case scenario. A group of patients were operated in the same OT by different doctors. First post-op day, everything over. Second, everything was okay. Second post-op day, they develop endophthalmitis. They are referred to a retinal surgeon. All patients are operated. Initially, they do well. And finally, they develop corneal ulcer and they lose vision. So what the patient does is, he approaches a lawyer. And what the lawyer does, interestingly, is he makes all the people involved in this particular case as respondents. So whenever there is a case, there is a complainant. And against whom the complaint is made is called as a defendant or a respondent. So right from the person who has actually, Yeah, yeah. Yeah, okay. Okay, fine. So right from the person who was involved in giving the fitness for the patient, he was also made a party to the particular case. Even the retinal surgeon was made a party to the case. Cataract surgeon, everybody, whoever was there in that area were made respondents in the case. So that is why, see, you should not.
Ashok, so you mean, if suppose a case is given against Ashok,
Yeah.
the hospital management also will be liable?
Yes.
So, Dr. Jain, probably you can explain that many of us are having only PP scheme for doctors. We take our own protection, PP scheme. But if the hospital is not registered under the PP scheme, there is some clause like that, no?
There is another hospital protection scheme for PP scheme, under PP scheme.
Okay.
So if the hospital is also taken hospital protection scheme, then IMA or the IMA advocate will also fight for the all the other doctors.
If the
in
hospital has
involved.
not taken, only the doctor is having?
Then only the doctor will be protected by the PP scheme.
Okay, so most of that is one thing that all of you should note. The hospital should also take PP scheme, hospital protection scheme. So, because most of the cases it will be first respondent will be doctor, the
Yeah.
second one will be the medical director or something like that, hospital.
The point is something called as vicarious liability. where
Vicarious liability is also
and
there.
they expect more compensation from the management of a hospital than from an individual doctor. So they include the management also.
If you want to get the hospital protection insurance for the hospital, all the doctors working in that hospital should be part of the professional protection scheme.
Yes.
That's what. And another point is, individual policies covers you for 1 crore now, around 1 crore, whereas hospital is covered only for 5 lakhs. That is what is existing right now.
Okay. Okay. So, Ashok, you can continue.
Yeah.
There's one question from the floor.
Yeah.
Government doctors.
Only doctor will be liable. Naturally. Because
No, there is no, there is one thing about that. What happens to government doctors is like, see, we talked about VP Shanta case. See, there are three situations that can come. One is the whole hospital, everybody is given free treatment. Okay. The second situation is for some people they are given free, some people they are like payment. And third situation is everybody is like payment. Okay. So Consumer Protection Act, people where they are taking money and partially paid and partially free. Both these categories are involved in the Consumer Protection Act. So as far
the
as the
second
government,
and third group are same.
they are same. So if I say, no, I didn't take any money from him, but you are taking money from other people. So that will not come, you cannot say that I treated him for free. So even if you take a registration charge in the hospital, that means you come under the Consumer Protection Act.
So this is important in camps because camp, some people get converted to paying in many places. They come to the hospital and then converted to paying. So everyone is liable. I have a case regarding that.
And government hospitals are liable because of that. Because here master is government, servant is the doctor.
Yeah.
So what will happen is government will take whatever compensation government will pay, and from your salary government will take the money every year. Like
As the biggest compensation against ophthalmologist is Krishna Omar versus State of Tamil Nadu, ROP, 1.9 crores. The chunk of the money had to be given by the Tamil Nadu government and the doctor pediatrician and then little by the ophthalmologist.
but the government will take the money from the pediatrician.
That is different.
That you
The
do.
government will cut your pension and gratuity. That is different. That is so that like Sinu said that if only one person is there, the case also will be against that single person. That is what.
Usually when they are giving, no, it's like management, everybody is involved.
If
It
it's
is
a
not like-
hospital, they will give.
Yes.
Yeah. In government hospital, it is the doctor, superintendent, and
Even the DHS or the DME will be given notice.
Yeah.
Secretary, including the health secretary.
Charge like that. Nursing superintendent or theatre charge,
Yes.
superintendent, the concerned doctor.
yeah. So it is the important thing is government doctors should also be very careful.
They are also
regarding
liable.
this.
It is not
Because
that they are
you
not
charge
liable.
1 rupee for a OP ticket, so they are consumers.
You cannot say.
Yeah, continue. Otherwise, we'll get.
Yeah, so this is what I said. Then, see, as far as these patients are concerned, sir, Charles sir, what do you think will happen in such a case? How will the court usually think in such a case? Like, you know, there is a cluster endophthalmitis. Okay, the patient goes to the court. And how do you think this usually plays out in the court of law? Charles sir.
The court of law, they always, when they come for hearing, they ask for an expert witness. Now, when I joined Calicut, there was a cluster endophthalmitis, about 13 cases in district hospital. And I was called as an expert witness.
Okay.
So if you could justify that this can occur, this is a accepted complication and proper treatment has been given. And in this group of patients, initial two, I think, cases, there was no expert witness.
Okay.
Those two cases who didn't have expert witness, the judgment was against the doctor. He had to pay the compensation. Later on, the expert witness came, and they brought an expert witness from Aravind Hospital.
Okay.
How can you ask for an expert witness, sir? The doctor, if case is against me, can I ask for an expert witness?
I think they can bring an expert witness.
Yeah. So the Supreme Court has got some things regarding the expert witness. Suppose there is a prima facie case and it is all evident. So in that particular situation, even the doctor cannot really say that, no, I want an expert witness. Usually the respondent brings the complainant brings the expert witness. Because the doctor always says he's a doctor, he's the expert. The complainant brings the expert witness, and it is not mandatory that the court should grant permission to have an expert witness. Court will say, let us see what are the facts. If the court feels just by looking at the facts, there is no need for expert witness, many a time court will not allow. So you have to convince the court that the case is so complex, there are a lot of factors which cannot be directly expressed to the court. Then the court will allow an expert witness and you can do that.
That will be appointed by the court?
Yeah, the court will say, like, you know, some institution. Another thing you can do is, you can file an affidavit, Satyavangmulam. Like you can ask an expert to write in your favor and ask the permission of the court and file it as a affidavit, this expert witness, that each person can do, like a doctor can do.
So
This
suppose a
happened
case is against you, you can file an affidavit with an expert witness. Or you can request the court that this is such a complex case, the court can ask for an expert witness. So these are the two things that is possible.
Yes.
I think in that Calicut case, the advocate who was arguing for the party who had the endophthalmitis requested for an expert witness, and it was granted.
Only if it is granted, then you can bring the expert witness. That is what I was telling. Many a time the court will, initially when you ask, court will say, we will see. We will see the case. Just like that, because they feel the doctors will always support the doctors. You cannot bring. So that is the important point here. We have two tests called Bolam's test and Bolito's test. See, Bolam's test means, see, you have an expert witness. See, I have done a case, something goes wrong. I bring my colleague and say, I also do like this, mine also, everything goes wrong. So that doesn't make it right. So what the court says is, there is something called as a Bolito's test. Bolito's test means not only should that be a standard of care, it should be substantiated by reason. Like journal evidence, textbook evidence, everything should be reasonable also. So as far as Indian courts are concerned, now we are going from Bolam to Bolito. Initially, I could bring two of my colleagues and say that I also have the same problem, and court will say,
Same
so
thing
that
they
is the main
ask,
thing.
what is the percentage of endophthalmitis in various hospitals? So we
And,
could we could produce the evidence.
Yeah.
So this is an accepted complication in highest sophisticated.
And always remember, expert witness is only a corroborative evidence. It is not a substantive evidence. Substantive evidence means any evidence you see, there is no doubt, everything is proved. You will directly get the judgment. This is only a corroborative evidence means that will also be considered by the judge when he comes to a decision. It is not the final word.
So the court will accept your expert witness, and it will not only it will think, and logically it will assess the situation and then take a decision.
Yes.
So court has more power. So that is the difference between Bolams and Bolito. Logical decision court will take.
Jayprasad sir, you want to say something?
Yeah.
Yes.
Ashok, standard of care and off-label use.
Yes.
How will the court take it?
Yeah, I'll just talk about standard of care. Off-label use, we have another case, we will come to that. No, I'll just tell you about standard of care. Because, you know, when I went through some cases in endophthalmitis, I saw two cases. One was, the judgment came in favor of the doctor. The other one, judgment was against the doctor. So in one case, they said, even though the patient had endophthalmitis, everything was done. All precautions were taken. Immediately intravitreals were given, everything. And we had this Bolam, Bolito, everything was collaborating with whatever was done. And the doctor was let off. In other case, actually, that's a case from Jibma. The surgery was done by some senior resident, etc., etc. So what happened was that was referred to an expert panel. An expert panel from Shankar Netralaya, LV Prasad, everyone said that the doctor is not at fault. He has taken all precautions. Now another doctor from Chennai who testified for the complainant, he said that povidone iodine was not put before surgery. Okay? And they asked to show the document, evidence. There is nowhere it is written that povidone iodine. So they say precautions have not been taken. That is negligence. That is why endophthalmitis happened. And hence that case went against the doctor. So this is the simplest thing. So what I'm saying is whatever you're doing, you please document. See, it is not enough that I imagine I have put povidone, I have taken. Even if you have not put, all patients you print and keep povidone iodine, everything you keep. So that whatever is not produced as evidence doesn't exist. So documentation, all this thing, is very, very important. So that is regarding standard of care. That is what I was trying to tell you.
Yeah, so this is a standard of care in endophthalmitis. AC, vitreous tab, intravitreal injection, vitrectomy, all these things. And your OT notes and OT sterilization procedures, all these registers, everything should be there. The advantage of having an NABH or something like that is everything will be there at hand.
In that Joseph Sai Hospital case, the basic problem was the doctor was not found to be faulty. When they looked at the OT is old, it is not according to standards. The inner thing all dilapidated. Then sterilization techniques is not made standard. Corporation permission regarding waste disposal is not proper. So many loopholes are there. No? So they say because of this, the patients developed finish. No. See, all these things will come up only when there is a problem. So that is standard of care includes even all these things. So if you are pakka about that, then you are safe. So you have to be very careful.
Yeah, so I did a literature search. There is something like PubMed. It is called India Kanun. Everything is there. You put endophthalmitis and medicolegal, all the cases in the different courts will come. You can select High Court and Supreme Court verdicts. There are 45 cases. I will show a few cases with some comments. This is not endophthalmitis, but this case is very important. After sterilization procedure, one lady became pregnant. But the court said, doctor is not liable for all the bad outcomes because there are some complications or some sequelae which are not. So this case is important for quoting. Now coming to endophthalmitis, there are different cases. Comtrust versus Sirajuddin in 2011. In fact, everything was done. Patient was referred to Ernakulam, from there went to Shankar Netralaya, and everything was done. Unfortunately, the patient lost the eye. The court said everything was done, but there was a delay of referral without vitrectomy for 3 days. So it gave 2 lakhs for the patient. So this is one thing. There is another case, Ina Jain versus Parao Devi. The commission found that cataract surgery was performed correctly and all the post-operative care was in line with the standard care. Everything was done. So court said, no problem. No, this case was dismissed. There was another case where the commission found that the petitioner had the knowledge of respondent's diabetes. Here what happened is the diabetes was not controlled. Our blood sugar was not checked. So the patient said my sugar was not controlled. Doctor said it is not my job to control he was rude and arrogant. Okay. So he got the result. Okay. Court said you have not, you can't say like that. So I am not opening a Pandora's box of whether to check blood sugar on the day of surgery or anything like that. That is different. But the court said that control of diabetes was mandatory. Without that, he did surgery, and so this came against the doctor. Another one, the court, National Consumer Redressal Forum gave verdict in favor of the doctor, saying that all the steps were managed. These are only a complication, and complication was managed correctly. Case dismissed. Another one, again, risk of infection is there after cataract surgery. If the consent is okay, dismissed. So most of the cases are dismissed, but 98% of the cases in National Consumer Redressal Forum and the Supreme Court are in favor of doctors. Unfortunately, many times the lower courts, we don't represent ourselves better and we don't get a good result. Many of the lower court goes against the doctor. This was an interesting case, Aravind Eye Hospital versus Thangamma in 2012. This was a CAM case. This is very important. In fact, in that case, one expert witness from Trivandrum, Dr. IP, said vision was 6/18 before surgery. This was way back, 15, 16 years back, 6/18, and it did not require a cataract surgery. Okay. In fact, that was the expert witness opinion. And the Aravind Eye Hospital beautifully defended this thing, and they were actually everything was done for the patient, but the sterilization procedures record was not produced, so the verdict was against the hospital. All these are in public domain. That is India Canon. You will get the whole verdict. You can go through that. Another one, Bolam test applied. They said endophthalmitis is a complication of IOL surgery. So I am just showing all these things because you don't have to worry about all these cases. In another case, the council gave a compensation of 1 lakh, saying that the findings are not recorded. Pre-operative vision, post-operative vision, nothing was recorded. These are the mistakes where the court will find, okay, you are guilty and compensation will be awarded. So if you are systematic and everything will be okay, 98% chance that doctor will win the case.
No, that's what I was also saying. It should all be documented. See, even if you sugar is high, I mean, I should not say this. You document at least a near normal sugar and then give the injection. So then it is there in this thing. And regarding CAM cases, there was one Dr. Modi who used to operate all over the place. So he, in one of his camps, he developed, a lot of patients develop end-off. See, there are places where court takes a lenient view. So they know this gentleman, Dr. Modi, is doing a great service by doing CAM surgeries. So the court felt at that time that by giving a huge compensation or going against the doctor, it is only going to, do disservice to the society, and they took a lenient view and asked state government to bring about new measures, how you can prevent such endophthalmitis can occur. So, I mean, it all depends because judges, courts, they're all human beings, they have different attitudes at different times, and based on the scenarios they do. And documentation is the most important thing, as Dr. Mahesh said. If everything is documented, you have evidence to prove that you are right, then you are okay. Otherwise, that is always a problem. Now, criminal proceedings against medical. So there are two types, two ways in which a criminal proceeding can go against a medical practitioner. One is 304A, that is death by a rash and negligent act. Okay, that is 304. See, if you look at 304A, it is a cognizable offense. Cognizable offense means you can be arrested without warrant. That is cognizable offense. But it is a bailable offense. Bailable offense means bail is a matter of right for that person. Non-bailable means it is not that he will not get bail, but it is not a matter of right. The court will decide whether he should get bail or not. So that is why when 304, suppose there is a surgery going on, the patient dies suddenly. So it depends on the police whether they have to take an FIR or not. It depends on them. Suppose the patient's bystanders go to the police and say that this doctor, due to his negligence, has killed my whatever relative. If the police feels that FIR is there's a real substance in what he says, they can take an FIR. Once they take an FIR, it's a cognizable offense. Even without warrant, they can arrest the doctor. But within 24 hours, he should be produced to court and he can come out in bail. To safeguard against this, Supreme Court, there are a lot of judgments, Jacob Matthew judgment and all that. They say that before a private complaint is entertained in the court or before the police takes an FIR, a report from an expert committee or expert group of government doctors should be presented in front of the police or the court so that they are convinced that there is something in this. And then only they should take action. So that is the Jacob Matthew case which has come out with that. And other way in which you can have criminal this thing is if you give a false medical certificate, you give false evidence, you say wrong things, etc., wrong report, everything, then also you can have criminal proceedings against you for cheating, forgery, those kind of things, in IPC. So that is how these things happen.
Dr. Jain? Yeah.
So I'll just add one thing. A police, as I said before, a police cannot straight away charge a criminal case against the doctor. If a patient complains to the police station, the police has to definitely put in an FIR. FIR doesn't mean that doctor is charged and he cannot be arrested. That case has to be referred to an expert panel constituted by the DMO and an expert from the specialty and from an anesthetist and public prosecutor and police superintendent of police, SP. So these 5 people will be constituting the expert panel and they will arrive at a conclusion whether there is a gross negligence. It need not be a negligence, it should be a gross negligence. And if they find that there is a gross negligence, then the case can be filed against the doctor and the doctor can be arrested. But then still there is hope for the doctor. If the first expert committee finds that there is gross negligence, then the doctor can appeal to an higher authority. That is the apex body. That will be constituted by the Director of Health Services, DHS, and then that will be a state level expert committee, and there you can be represented by an advocate. Here, the first expert committee, you won't be called to appear before the committee. They'll just go by the case sheet, whatever you have written in the case sheet, and by the FIR filed by the police. They'll just go by the case sheet and the FIR filed by the police, and then they will arrive at a conclusion whether there was a gross negligence. And you won't be even knowing whether the expert panel has been constituted or not. But if the verdict comes against you, then you can appeal for an higher apex committee, and there you can be represented by an advocate. So these are then only you can be arrested. So you need not be afraid of any criminal case against you.
Gentlemen, sir, does it happen practically? Because many times
It
we say
happens
immediately
practically.
immediately
It
the
happens
doctors
practically.
are
All the
arrested even
cases
before-
against doctors,
Okay.
it happens practically. This is how it is,
Happening.
because there is a circular
But that
memorandum
first day, the
issued by
damage
the.
will be done. The first day, all these incidences in the hospital, the damage will be done. Media. Here we are not talking about media.
Yes.
All other things we are properly, if it is done, it is
Gentlemen,
okay.
sir, how do you propose to restrict this collateral damage? Because, it comes in TV, a lot of people know, the doctor's reputation goes. So how do you think IMA, do they have anything to take care of all that also?
Now the new hospital protection law has come into being. That is a very strong law that has been made available to all healthcare professionals. So definitely, that will be putting an end to all this
yeah.
immediate.
Yeah, I think the new law, the ordinance which has been made into a law, it says people who instigate as well as people who actually do, they are involved in this. But the thing is, see, I think as doctors know, when something comes, I think you should approach a lawyer immediately and file a temporary injunction in the court restricting media or somebody from publishing adverse comments against you. I mean, those kind of, media management also we should do, because once your reputation is gone, a rejoinder after many days saying that we were wrong, nobody reads. The reputation once goes, it goes.
Media management is a big headache. That also you can approach IMA. If there is any video that is being circulated against you in the Facebook, you can always go and block it. If immediately more than 100 people go and complain against that video, then definitely it will be blocked. So that should be done. We should not keep it to ourselves. We should try to approach the local IMA and then get your friends to block that or complain against that video. Then definitely it will be blocked.
Jayprasad, sir, how do you think, in your practical experience, how do you think, how do you manage these situations?
I have not come across such an issue where I had to confront the media, but cases where I have got associated with a couple of my friends who had, not in our specialty, other specialties, they had a really tough time. The media just tore them apart. And not only their professional career, but also their mental status, they were devastated actually. So I think at that point of time, IMA has a crucial role, and I think KSOS also has a crucial role to play to help them, support them during that phase.
Hopefully, KSOS also will have more active crisis management to help. At least they are all our colleagues. So, especially if a cluster is coming, we will formulate something for KSOS also.
Charles sir, when something happens, what do you think the doctor should do first? Like, when you have
Do you need police intimation, sir? If there is a death in the hospital or suddenly 10 patients got cluster endophthalmitis, do we need to inform the police?
I don't know whether we should inform the police, but a death in the hospital, if it's during surgery and all, it can be considered as a medico-legal case. Even a complication of any treatment can be considered as a medico-legal case if the patients and the relatives complain. Media management, it's very difficult. I think the hospital authorities and the other people, diplomatic movement, your own charisma, everything. But nowadays it's very difficult. Olden days we could manage somehow, but now
that's true.
even small issues are blown up out of proportion.
That is true.
Okay. Regarding off-label use of medicines, actually a lot of people, we use lot of off-label medicines. The typical one is Avastin. There are court cases for and against Avastin endophthalmitis. One of the court cases said they applied Bolam test and they said surgeon is not liable. But in a major verdict from Telangana, actually the DG drug controller of India, drug control. If they have not approved, we should not use. That is the final stand now. So Avastin, some complication come, it will be very difficult for us to, but there are a lot of, like in pediatrics, 96% of drugs are off-label. So, but nobody goes for Avastin. I think these sort of cases we should not start using. Once upon a time, there was no other alternative other than Avastin, and extremely expensive one drug.
Correct.
So now there are a lot of alternatives. So that is regarding Avastin and ophthalmitis. Now case 2.
Yeah,
Ashok.
this is one of the cases I had against me. This happened maybe 10 years ago. What happened was there's a gentleman who came with an exudative RD and choroidal detachment and vitritis with severe loss of vision, hand movements or something vision in one eye. And everything was done. For me, it looked like a uveal effusion syndrome or a VKH kind of picture. So after doing a uveitic workup, systemic steroids were started. Initially, the patient improved. After some time, the improvement was not so much. Patient was referred to Aravind Eye Hospital. There, it was diagnosed as a rare variant of atypical CSR. Patient was stopped steroids, gave multiple PDT, etc., did not resolve. After 6-7 months, they had to go in and do a vitrectomy and drain the fluid and settle the retina. Finally, in that eye, vision improved to 612. In the meanwhile, after visiting me 6 months later, the patient developed the same disease in the other eye also. So that time the picture was confusing because, patient is not on steroids, nothing, being treated, still other eye has developed the same picture. So again, from one hospital, it was sent to another Aravind hospital for a second opinion. There it was diagnosed as uveal effusion syndrome. And drainage surgery was done to resolve, etc. That also didn't work. Multiple PDTs, nothing worked. And again, that eye also, vitrectomy was done, retina was settled. Vision in that eye improved only to 636.
In other words, diagnosis of initially VKH, then CSR, atypical CSR, and then uveal effusion
syndrome.
So these are the three experts gave three sort of.
So for uveal effusion syndrome and VKH, the initial line of therapy is steroids. But for CSR, you cannot give steroids. So patient after 10 years, he felt that, I have been wronged, and he went against me. And actually, he filed a case in the National Commission for 13 crores. 13 crores.
That highest possible in National Commission.
So if you look at the Indian Kanun, you can see my name also. If you
District Council, District Forum, 50 lakhs.
You know that person.
District Forum, 50 lakhs.
Actually, the jurisdiction of National Commissions also, I'll just tell you, because if it's a District Commission, up to 50 lakhs. A claim, up to 50 lakhs is District Commission. 50 lakhs to 2 crores is State Commission. And more than 2 crores is National Commission. So original jurisdiction when it comes to the National Commission forum, it is very, very less. Like my case, very, very few cases come to that level. So that is how, these cases are graded, how gradation of cases happens like that. So the important points here is, see, differential diagnosis or an error of judgment is not negligence. That is the basic thing that you have to understand. So this is like, when you have a differential diagnosis, see, the same case can be managed in different ways. Managing in one way is not negligence. So that is the basic message I want to convey. And error of judgment is also not negligence. Given the circumstances, with the doctor has done all the tests, etc., and he sincerely feels that this is the diagnosis and he treats. Even if it is wrong, it is not negligence, because doctor, according to his reasonable care and knowledge, he has done all these things. So when this case came, actually, first we got a legal notice. So legal notice means it is just a warning that is given to you. The case is still not in the court. They give you a warning saying that, I'm going to go against you. If you don't give me this much money, then you will be sued. You better give me the money within this much days. So, Charles sir, how do you think we should go about with legal notice? When you get a legal notice, what should you do?
As long as we don't know anything about the outcome of the procedure, it is better to consult have a legal opinion. Before doing anything, now IMA is supporting us.
Yes.
You can straight away go to IMA or a private legal advisor to have it. So don't give reply on our own.
Yes.
Without consultation, don't do reply.
So basic thing is, always a legal notice should be replied. You should not say that, I will not reply. Because if you don't reply to a legal notice, it means you are kind of accepting their claims. And finally, when it comes to the case, you will be in soup. Jane Simon, sir, you have something to say about it.
That's what. That's true.
That is important.
Definitely deny all the allegations
Yeah.
raised in that advocate notice. That's all you have to do.
And Dr.
And
Mahesh, you have
to-
some difference of
yeah.
opinion on that. You
That
can
is,
say.
sir, actually you have to sit with the advocate and read sentence by sentence all the allegations and prepare a notice, reply and reply notice. Sitting with the advocate, don't give it to the advocate and he will reply. So, because he doesn't know all the intricacies of CSR and VKH and all the other things.
Yes,
So
yes,
you have to sit and then tell him what this is this, I have done this.
Yeah, and
So
the next...
spends time, because in fact, some of my cases I have spent 4 hours sitting with the advocate from 7 o'clock to 11 o'clock.
Yes, yes.
So,
Yeah.
I'll just add one thing. Previously, what IMA used to do was we just used to do a denial letter for all the advocate notices. Because as you know, IMA, PP scheme secretary is always flooded with the cases. So, but now since KSOS have got legal luminaries, I think we should change our strategy.
We have changed strategy.
If there are any opthal cases coming up against
Yes,
any
yes.
ophthalmologist,
Yeah.
then KSOS should intervene and
Yeah,
give a
yes.
detailed
Yes.
reply
Reply
to
to
the
the legal
advocate
notice.
notice
That is
itself.
very correct.
In IMA, what we do is we give only a denial for the advocate notice.
Yes.
And whenever, if at all, the case comes up in a court, then only we give a sentence by sentence,
Yes,
word by word,
yes,
a
yes,
detailed
yes,
reply to the court, directly to the court, not to the advocate.
let me give one example. I've told in many fora, actually there was a VKH case where angiography I did, classic VKH, gave steroids, hand movements became 6 by 6. And 3 months later I got a notice from the advocate. After my treatment, his skin has become white, pand. So it is vitiligo. Actually, vitiligo is part of VKH. So I gave a letter with everything, the report like thing. This is angiographically proven this thing, and vitiligo is part of this syndrome. Everything. It never went to the court.
Yes, that's true.
So strong cases, I think we should reply like this.
Yes.
If there is some loopholes, like Dr. Jain said, we can deny first and then point by point we can defend later. So this is a variable thing.
And the next thing, once you get a legal notice, you give a reply, and then it depends on, as Dr. Mahesh said, whether the person will go to the court or not. Once he goes to the court, it is not that the court needs to accept the case like that. Because there is something called as limitation period. There is something called as cause of action. Cause of action means when the injury has occurred or when the event has occurred. If there is a delay of more than 2 to 3 years after the cause of action, you cannot approach the consumer court. The consumer court will not take up the case. But in the practical sense, it is not like that. If the person, because consumer court is for the consumer. If the consumer says that I was in the Gulf, I was in America, I could not write, I could not see like that, then the court will give a leniency. Now, once the court accepts the case, the court will send a summons to you. Okay, by registered post, and you have to acknowledge it. And the summons will contain whatever allegations the patient has said against you. And once you get the allegations, you have to reply within
45 days.
For 30 days.
30 days.
Maximum grace period is 45 days.
45 days.
So it is very, very important because, see, it is not the lawyer's headache. It is your case. You have to sit and reply. So you have to do it as early as possible. You will just get the notice, you will get the summons and you will keep quiet. The day before the last day, the lawyer will call you and ask you, doctor, reply is ready, Then only you will realize you have not even started. So it is very, very important. The importance of this is, if you don't send a reply, this is called as a written statement. Okay, this reply is called as a written statement. If you don't send a reply, you will lose the opportunity to challenge the patient's allegations. And the case will be, judged ex parte. Ex parte means there is only one party. They will listen to the patient and they will give a judgment against you. And once that 45 period time is over, then you cannot give a written statement. Even if you write and give, I'm sorry, no, sorry, it will not be accepted.
So when you get a notice, consult your local lawyer and then sit with him in that week itself. Don't postpone it. I don't have time.
Yeah.
So just...
and once you write a written statement, the patient or complainant will again send back a reply. That's called rejoinder. He will say that whatever you wrote in the written statement will be refuted by this thing. And the next phase is like, interrogatories, questionnaires, dealing with the witness stand, etc., etc. And then there will be a final hearing. And after the final hearing, the case will be decided by the judge. And once it's decided in the district forum, you can go to appeal to the, state forum. State forum, you can go to the national forum. From the national forum, the appeal is to the Supreme Court. So there are two types of appeal. One is statutory appeal. Statutory appeal means the Consumer Protection Act says you can go for appeal. But one catch in the 2019 Act is, suppose the district forum has given 1 crore compensation against you. You have to pay 50 lakhs first, 50% of the amount first,
As
and then
deposit.
only you can go for appeal to the next form.
Deposit in the
Deposit,
code.
yeah, that is one important thing.
Draconian rule.
Yeah, and second thing is like there is a non-statutory appeal. You can something called a special leave petition, SLP. You would have heard special leave petition. So that you have to go to the Supreme Court, saying that some court has done gross injustice to you. You are suffering because of that. But that is not a statutory appeal. The Supreme Court will see whether that appeal has to be entertained or not. If it is not entertained, it will be thrown into the dustbin. So it is a very, 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 very dangerous situation. See, suppose even if you are going for appeal, you have to pay some money, means that is really bad. And it is applicable only from 2020 June, because that is when the 2019 new act came into force.
So the
that is
take-home
basic
message
thing.
is the district forum itself you should defend very strongly.
Yes.
That is don't take district forum lightly. So if you have to go up with a, there may be a lot of factors. Yeah.
Voice of lawyer once again. I think you should choose a lawyer who is familiar with medical legal case.
Ideally, yes.
is very important.
Now currently if you see the IMA lawyers have the maximum experience. IMA, each district they have a person in charge of their, or a panel, right, Dr. Jain? A panel. They have a lot of experience. If you have your own person whom you, I think they can be asked to represent in IMA.
If we have a panel in each district, we have different panels for consumer and also for criminal cases. So we have, and if you are not happy with the panel of advocates provided by the IMA, then you can always opt for your advocate, but that advocate will be paid only whatever we are giving to our advocate, what the other money you'll have to pay personally.
So the over and above expenses you have to pay. That so that is it.
And another important point is, whenever you are giving in your written statement or initial thing, you should tell everything. After the judgment, you cannot say, I forgot to tell, now you change it. It's not possible. Whatever has to be said, should be said initially only. The point with appeal is only on the matter of law, not on the matter of fact. See, when you go for appeal, you cannot say, that day that happened, I want to file one more evidence. No, it's not possible.
You can't bring new evidence.
Yeah.
Whatever you have given in the written statement, that holds good. Whether you are going up to the National Commission or even up to the Supreme Court, whatever you have given in the initial written statement.
Yeah. You cannot add facts.
You cannot add anything.
So first shot is the best shot. So initially only you have to take. What happens is initially you give little bit. Now you fail, you give it to a big lawyer. There is no use.
No use.
Like that. Yeah.
Yeah.
We had 2-3 instances where the petitioner's advocate asked for a consultation to discuss about the case with me. So how should we react to them? They want to study the case, they ask all the questions and doubts like this.
The case was against you or somebody else?
Somebody else.
Somebody else. That actually is a dangerous situation. We should not ethically.
You should say in favor of the doctor, sir. You should say in favor. Whatever he has said is correct only. You should say.
If it's a
Should
very
say that whatever the doctor has done is fine. And I would have done at the same circumstances.
No, they may not reveal the details of the case. They may be asking just like what is the ideal treatment and all this stuff. So if we give something and that is not there in the other one, that whatever you said will be used against that doctor.
Yeah.
It's a very tricky thing.
And one more
ethical
thing,
aspect
and one more thing, there is something called ADR, alternate dispute redressal. So even for consumer courts, out of court settlement is possible. So in Trivandrum, Law Academy has taken over this ADR process. So the court will appoint an arbitrator, and the lawyers and both parties can sit together and resolve the case. I think we are running short of time. We are only 11 minutes more actually.
Ashok,
Yeah,
one point I want to make. If you have a patient who comes to you with a problem that has been a complication of some other doctor,
Yes.
and they are asking you for your opinion,
Yes.
I think every one of us should be very careful with our words.
Yes.
It's absolutely
That
important.
is true, sir. That is
Yes.
true.
I had one patient, endophthalmitis elsewhere, going into phthisis, coming, educated people only. They came only for opinion.
Okay.
So wording should be very careful.
Careful. That's true.
And whatever you tell the patient, You have to emphasize that these are problems which have happened in our hands.
Yes, sir, that's true.
Yeah,
These do happen.
This-
And the
that
most
is-
common source is the patient's own eyelid.
Correct.
These 2
correct.
points you have to highlight repeatedly.
I think
Prevent.
all of you should
Yeah.
listen to that. Yeah.
Samira, one question, quick
Regarding
question.
the,
Yeah.
that matter which sir has told, actually, in fact, these patients, when they come for the second opinion, what they do is, they actually, like, 2 persons will be sitting there. One will be actually recording the audio.
Yes.
One will be recording for the video. So this has happened to me like 2-3 times and all. Like when Prakash has operated, the vision is not there. It is correct and all. So that
Prakash.
becomes very difficult. Oh,
Now only
so-
everything is coming out.
No, actually, so what can be done actually? Can you tell the patient or should we stick it on our center that
10 minutes.
this is not done, or is it legally, is it
No.
right for a person?
First thing is, no, according to the Information Technology Act,
Sir,
without knowing all these things, you should not record. That is the first thing.
So
You should
whether
break
we
the
should-
cell phone.
Whether we should exhibit in our centers that recording an audio or
No,
a
it is
video?
not. You should. Because Information Technology Act is there, which prohibits doing such things. There is an act. There is a law against doing all these things.
Recording without your
Without
permission
knowledge.
is illegal.
Illegal, yes. So that's
So,
it
okay.
is an infringement to right to privacy.
Now this, regarding consent, it's a big topic. I can't discuss the whole thing. Samira Kohli, not this Samira. So what we are going to do is probably KSOS can bring out a booklet of Malayalam and AOS has a consent book, beautiful consent book. It is very extensive. Probably it can be trimmed to our needs and our this thing. Probably we can bring out a Malayalam version in the next year. That is one of our plans, consent regarding all the consents. So if it is a standard one, it will help a lot. Like written consent, how to make all these things. So I am not discussing this because of lack of time. AOS consent book, all of you should download it and keep it. You can modify the words and translate it into Malayalam and then ask your patient to sign.
Mahesh,
Yeah.
that UK concept and American concept.
Yeah, in fact, the consent that we follow is legally valid consent based on the Samira Kohli case. In UK, it is real and valid consent. That means you don't have to tell every complication regarding the surgery, rarest complication. But in US, it is the real informed consent, where you have to tell each and every complication. Sympathetic ophthalmia after cataract surgery, you have to tell. So we are generally following what is UK consent. Real and valid consent is legally valid consent in India. Yes, so that is the thing. We don't have to tell everything, but you should tell the serious rare complications like endophthalmitis in cataract surgery.
yes,
It's a serious but rare complication. And common not so serious complication also you can measure, like you can mention, like PCO. Suppose a PCO can come, something like that. Small, it's a treatable problem. So we will work out regarding consent and bring it next year. That is.
Recently, I have done, one of my friends who sent me a patient, primary angle closure suspect, advised YAG-PI in the US, and on the day it was advised, he was given a letter, a detailed possible complications, all possible complications, and this fellow got terrified. He said, should I undergo this procedure? This has got so many complications, should I? So that is one issue of telling all the complications. Patient may go from you and go to the next consultant also, to the next hospital. So there is a line where you have to tell them, but you have to tell them that's an art and science, I think, in informing them about the various complications and the potential risks when it comes to managing a patient.
But Supreme Court is in favor of this real and informed consent.
Real and informed.
They
You don't have to
insist
tell
on
each
the
and every rarest complication.
You don't have to tell. The
But you have
courts
to
are-
basically, in fact, the old, if the complication rate is more than 3% or 1% or something, you have to mention in, that is a general standard rule in UK.
correct.
I don't exactly remember, but not 1%
you
and
don't
all,
have to-
you don't have to mention. But endophthalmitis, we will mention in cataract surgery. So regarding the last part, one is you can get notice from the medical council. I had given all of us give, this patient has so and he may be granted leave on medical grounds for 2 weeks or 3 weeks, like that. So please make sure that you don't give more than 2 weeks, and you give, you countersign the patient's signature. These are all important things. I was actually warned by the medical council for giving a medical leave like this in the, we all give actually, to whomsoever it may concern. So and so has this thing, you may be given granted leave for medical council. Dubai patients and all, you give 1 month, 2 months and all you give. So you will be in trouble. Don't give more than 2 weeks, and you have to take a countersign in the standard form. So Charles sir can highlight on this medical leave certificates and some of the, yeah, can you put the other Charles sir?
Now, we have been discussing all the complications. Now, while we write the accident wound register, what are the things we should be careful? So, when do we think, we sit in the casualty and see a case, how do we know this is a medical legal case? Any case or ailment that requires further investigation by the law enforcing agency to ascertain circumstances and fix responsibility for the occurrence can be considered as a medical legal case. Now, failure to handle this case, MLCs appropriately, will attract legal penalty, and we are liable to be prosecuted under IPC 201. So, don't take medical legal cases lightly. Can the private practitioner refuse to examine a medical legal case? What do you think, Ashok? Can the private practitioner refuse examination of a medical legal case? They cannot refuse.
At least in the emergency.
No, we have to, it's our duty to examine the patient, meticulously document it, and provide appropriate medical care. But we need not be, we need to be non-judgmental. Whether the onus of fixing the responsibility, whether that patient, this person is guilty, is off the court. We just want to document it. And the police should be intimated in all medical legal cases appropriately. Now, this part in filling up the wound register, you should be very, very careful. You should write, ideally you should have triplicate, but nowadays we use only duplicates. The date and hour of examination is very, very important. It should be legibly written. The name, age, and the gender, address, and marks of identification should be very important. And it's always better, you should always specifically write the by whom brought, whether the patient is coming alone or brought by the friends or relatives. The next part is very important, history and the alleged cause of injury. It should be written in patient's own words, in the vernacular language. It makes a lot of difference. എന്നെ അടിച്ചു എന്ന് പറയുന്നതും എൻ്റെ കണ്ണിൽ കമ്പ് കൊണ്ടു എന്ന് പറയുന്നതും വ്യത്യാസമാണ്. വടി വെച്ച് അടിച്ചു, ദാറ്റ് യു ഷുഡ് റൈറ്റ് ലൈക്ക് ദാറ്റ്. എൻ്റെ കണ്ണിൽ ആസിഡ് തെറിച്ചു, ആസിഡ് ഒഴിച്ചു എന്ന് പറയുന്നതും ആസിഡ് തെറിച്ചു എന്ന് പറയുന്നതും വളരെ ഡിഫറെൻ്റാണ്. ഞാൻ വീണു, കല്ല് തട്ടി, എന്നെ കല്ലുകൊണ്ട് അടിച്ചു, അങ്ങനെ ദാറ്റ് ഹാൻഡ് കൊണ്ട് അടിച്ചു. വാട്ട് എവർ ദ പേഷ്യൻറ്റ് സേസ്, യു ഷുഡ് റൈറ്റ് ഇറ്റ് സ്പെസിഫിക്കലി ആൻഡ് അറ്റ് വേർ, ഹൗ ഇറ്റ് ഹാപ്പൻഡ് ആൻഡ് വെൻ. That should be clearly written. And details of injury right from, just like we write our case sheet, it should be very detailed description. Any lid tear, whether it is involving the lid margin, whether involving the canaliculus, whether it is a subconjunctival hemorrhage with hematoma, which leads on to suspect of a rupture globe, any corneal injuries, hyphema, any RAPD, fundus findings, everything should be beautifully written. If you suspect a foreign body, you should send for investigations, and that should be documented. We have sent for ultrasound, we have sent for CT or MRI, we have sent for cross consultations, maxillofacial and neurology consultations, etc. So this all should be documented, and finally you should sign it. That's very important. There are a lot of medical certificates being issued without signing. So you should sign it, and then the police intimation, once it is okay, they will come and take it. Sometimes you wait for 1 or 2 days to sign so that we can complete everything. By the time, the police will come and take it off. So you will have a certificate in the court without signature. So if you are meticulous in documentation, honest and ethical in your practice, I think there is nothing to fear.
Thank you, sir. Actually, the wording should be exactly correct like the patient says. There was a case in Lokayukta where the doctor has written mini lorry and bus. Actually, it was mini bus and lorry. Actually, it was mini lorry and bus. So because of that difference in the words, the patient did not get compensation, though the patient filed a case against the government doctor in Lokayukta. So everything is possible in this world. So that is what I want to say.
In private hospitals, I think there is resident medical officers in major institutes, casualty medical officers, who is writing all these things. He will be the first doctor who is seeing it. We need not do. We will be the second expert consultation.
Actually, in our hospital also, some medical legal cases, we intimate the local police station. We have this thing. So that is not informing the police is not a excuse. In fact, I was roasted in one court for not informing the police in a case of assault, which I saw some 15 years back. They asked me whether you know that it should be intimated to the police, why you didn't do, whether it is assault. So I was literally roasted.
Mahesh, the casualty can be see the patient, give primary care, take care of the emergency situation, and then refuse to treat further and send the patient to another hospital.
Refuse
Is
to
there a
treatment in
liability
the
only
sense,
till treating that immediate?
immediate care you have to give. Immediate care, like a corneal tear is there, or corneal abrasion is there, you give bandage. But if the patient is having a neuro problem, you can't keep the patient in your hospital. You have to send it. But it is only eye and you can manage, you keep the patient with you. Just because it is an assault, you can't send the patient if it is only eye problem, if you can manage.
Sir, madam has a question.
Yeah.
Condition on discharge എന്നുള്ള മെഡിക്കൽ വൂണ്ട് സർട്ടിഫിക്കറ്റിൽ ചോദിക്കുന്നുണ്ടല്ലോ.
അത് എഴുതിയില്ലെങ്കിലും കുഴപ്പമില്ല.
അപ്പോൾ സാറേ ഈ നമ്മുടെ അവിടെ ഡിപ്പാർട്ട്മെൻറ്റിൽ കഴിഞ്ഞ ദിവസം ഒരു ഡിസ്കഷൻ വന്നിരുന്നു. അപ്പോൾ അതിൽ അവർ പറയുന്നത് ഫസ്റ്റ് ഡേ തന്നെ സൈൻ ചെയ്യണോ അതോ വെച്ചാൽ ശരിക്കും അവർ കണ്ടീഷൻ ഓഫ് ഡിസ്ചാർജ് കഴിഞ്ഞിട്ടേ അത് വൂണ്ട് സർട്ടിഫിക്കറ്റ് കീറാവും.
പക്ഷേ അവർ പോലീസുകാർ
പോലീസുകാർ എപ്പോഴും ഫസ്റ്റ് ഡേ തന്നെ കീറും.
പോലീസുകാർ ഇൻറ്റിമേഷൻ കൊടുത്തു കഴിഞ്ഞാൽ നെക്സ്റ്റ് ഡേ 24 hours വന്ന് അവർ കളക്ട് ചെയ്ത് കൊണ്ടുപോകും.
Even if you have not signed.
സൈൻ ചെയ്തില്ലെങ്കിൽ ഐ ഹാഡ് ഫ്യൂ ഇൻസ്റ്റൻസസ്. എൻ്റെ കൂടെ വർക്ക് ചെയ്ത ആൾക്കാർ പുറത്ത് പോയിരുന്നു, ദുബായിലൊക്കെ പോയി. അപ്പോൾ ഐ വാസ് ആസ്ക്ഡ് ടു അപ്പിയർ ഇൻ ദ കോർട്ട് ടു റീഡ് ദാറ്റ് ആൻഡ് 2 certificates were not signed. അപ്പോൾ കോർട്ട് വാസ് മേക്കിംഗ് ലോട്ട് ഓഫ് ബാഡ് കമൻറ്റ്സ്. വി ആർ ഇറസ്പോൺസിബിൾ, വി ആർ നോട്ട് ഡൂയിങ് പ്രോപ്പർ തിങ്സ്. ഇറ്റ് ഷുഡ് ബി സൈൻ, ഇറ്റ് ഷുഡ് ബി ഡെഫിനറ്റ്ലി സൈൻ. ഈ കണ്ടീഷൻ ഓഫ് ഡിസ്ചാർജ് ഒക്കെ 15 ദിവസം കഴിഞ്ഞ് ഡിസ്ചാർജ് ചെയ്യുന്ന പേഷ്യൻ്റെ കണ്ടീഷൻ നമുക്ക് അപ്പോൾ എഴുതാൻ പറ്റില്ല.
So whether to sign on the day of admission or after discharging the patient.
It should be written in your own handwriting and it should be signed after filling up, immediate ആയിട്ട് തന്നെ. And we can write the further treatment, you can ask for the IP or other sheets, continuation sheets.
Yeah.
So I asked them to write us the patient is admitted and with the IP number. You can write there.
Yeah.
You can
And sign it initially.
Sign it initially. Otherwise, they will tear it off without signature.
Without signatures, it is invalid.
Invalid.
And
usually
it can be prosecuted because we have what is it, തെറ്റായ രീതിയിൽ അത് ഇഷ്യൂ ചെയ്തെന്ന് പറഞ്ഞിട്ട് പ്രശ്നം ഉണ്ടാക്കാം.
False medical certificate.
So we are running out of time. One question, Ashish.
Just one thing, sir. Some patients will initially not tell the correct history because they don't want to file the case. And then they may change, like they'll say, I slipped and fell, and then later they'll say, Allah, husband hit me on the face. So when you're writing the history exactly in the patient's this thing, what do we do when it comes to that? And do we inform the police if you actually suspect actually there may be an assault?
I think we should inform, if you are in doubt, always it is better to inform the police. നമ്മൾ എഴുതിയത് വെട്ടിക്കളഞ്ഞ് രണ്ടാമത് എഴുതരുത് ഒരിക്കലും. റീറൈറ്റ് ചെയ്യുന്നത് നല്ലതല്ല. അങ്ങനെ റീറൈറ്റ് ചെയ്യുകയാണെങ്കിൽ then you have to counter sign.
Similar case was there. Initially said fall, then actually it was hit by husband. Then 2 years later they got divorced. Then they want to file a case against the husband. They want to change it. This has happened somewhere. I read this. We can just not, now the patient has changed, you note in the file and then intimate.
Better is whatever is
not
the truth you should write. You should not, try to find out what is. That is not our job. That is the job of the police.
So that initially you wouldn't inform the police and you wouldn't make a wound certificate if it is just a bruise on the something like that. Or do you inform the police anyway if they have a fall? And
No, every fall need not be intimated, no?
No, this always you can write, no? Now the patient is saying, Alice, this thing, that is why I'm informing you. Tell the truth, that's all. I mean, nobody will find fault with you for that.
Yeah. Okay, okay. I think we are running out of time, 0 time. Thank you, Charles sir, Jain sir, and Dr. Jayaprasad for giving, and all the audience for active participation. We will be available for one-to-one interaction in Studio Hall, Level 1, Hyatt, after 2:30. So you can come and actually, anybody gets a legal notice, you should share it with others so that we will learn from your mistakes. That is the way it should be. I have, me and Ashok has shown all our cases. So it is nothing wrong in, it is like showing your complication in an academic forum so that others learn from that. Yeah. One photo. Thank you. From 2:30 we will be available for one-to-one interaction for 1 hour in Studio Hall.